The Gerontological Society of America, Meaningful Lives as We Age. Welcome to GSA Policy Profiles, providing insights into current aging-related policy issues from those at the forefront working to develop evidence-based policy. Welcome to another installment of GSA's Policy Profiles podcast. This podcast will explore the latest data and policy potential presented by the National Alliance for Caregiving and AARP's Caregiving in the U.S. 2025 report. My name is Trish D'Antonio, Vice President of Policy and Professional Affairs at the Gerontological Society of America. Joining us for our discussion today is Jason Resendez, President and CEO of the National Alliance for Caregiving. I'll introduce him shortly. Let me tell you a little bit about the National Alliance for Caregiving, founded in 1996. Led by founder Gail Gibson Hunt, a group of national organizations came together to meet the needs of caregivers in an aging America. The National Association of Area Agencies on Aging, now known as U.S. Aging, the American Society on Aging, the U.S. Department of Veterans Affairs Office of Geriatrics and Extended Care, Glaxo Wellcome, and the National Council on Aging worked together to create a new association that could address the public policy needs of families and quantify the impact of one of the largest unpaid workforces in our society. The National Alliance for Caregiving envisions a future where family caregivers thrive because caregiving is sustainable, equitable, and dignified. National Alliance for Caregiving's mission is to catalyze system change to build health, wellness, and financial security for all family caregivers through research, policy, and narrative change. Now, please allow me to introduce someone who is no stranger to GSA and our members, Jason Resendez. As the National Alliance for Caregiving's president and CEO, Jason leads research, policy, and innovation initiatives to build health, wealth, and equity for America's 53 million family caregivers. Jason is a nationally recognized expert on caregiving, aging, and research equity. In 2023, he was named one of the most consequential leaders in health science and medicine by Stat News. Prior to joining the National Alliance for Caregiving, Jason was the founding executive director of the Us Against Alzheimer's Center for Brain Health Equity and was the principal investigator of a Healthy Brain Initiative cooperative agreement with the Centers for Disease Control and Prevention, or CDC. While at Us Against Alzheimer's, he pioneered the concept of brain health equity through peer-reviewed research, public health partnerships, and public policy. Jason has advised federal agencies and organizations working to advance equity for communities of color, including the National Institute on Aging, the National Academies of Medicine, the Administration for Community Living, and the Congressional Hispanic Caucus Institute. Jason, welcome. We're so thrilled to have you here today.
Thanks for having me, Trish. So excited to be here.
And let's jump right in. I know that the National Alliance for Caregiving has been publishing this report with AARP, Caregiving in the United States, since 1996. And recently you published the 2025 report. This clearly links caregiving to significant personal financial strain. What innovative policy mechanisms, such as comprehensive federal tax credits, universal caregiving stipends, or retirement savings protections, present the greatest opportunity to stabilize household finances and provide tangible recognition for the massive economic value of unpaid care?
Yeah, absolutely. Definitely all of the above is how we think about it. When we look at data, and as you mentioned, we've been doing this research in partnership with AARP for nearly 30 years. And what we've seen in the data is that caregiving is becoming more prevalent. We've seen that there are over 63 million Americans navigating ongoing complex care in this country. And we really see that as the floor, not the ceiling of family caregivers. And one of the hallmarks of that experience has been financial strain and impact. What we see with the latest data from 2025 is that nearly half of family caregivers, 47%, experience at least one negative financial impact due to their caregiving responsibilities. And I think this is a common experience in caregiving, but it's also the result of our policy decisions, right? It's not, caregiving fundamentally it doesn't create economic stability. It's a lack of supports in place to recognize and value caregivers that create those outcomes related to economic insecurity and impact. And what we see is that family caregivers are going into debt. They're stopping their savings. They're having to take out high interest credit cards in order to make ends meet. So the landscape of those impacts is really diverse. And so the policy responses to better supporting family caregivers financially need to be really diverse. And we ask family caregivers, what are the policies that you want to see in order to create economic opportunity? They fall into really three buckets. One is, not surprisingly, family caregivers want to get paid for their caregiving responsibilities. One of the number one questions that we see in peer support groups and online chats is, how do I get paid to do this work? And it's no wonder this work is valued at over $600 billion annually, according to AARP. Yet family caregivers really recoup very little of that value. It's really the Medicare program, the Medicaid program, hospitals, insurers, right, are really reaping the benefit of that unpaid and unrecognized labor. So family caregivers want a slice of that, right? Because they need it in order to be able to provide high quality care, to make sure their care is sustainable. And we started to see movement in that direction. Through Medicaid funded self-direction, we see more and more family caregivers having access to direct payments as part of their caregiving journey. And this really was a byproduct of the global pandemic, where there's already a shortage of direct care workers, but one of the impacts of the pandemic was that getting a lot more prominent. And so states started to introduce programs and Medicaid started to introduce flexibilities for more family caregivers to become eligible for payments when they couldn't find a direct care worker in their community. So over 11 million family caregivers in our data report receiving some form of payment for their caregiving experience. We're starting to see some of those things get called back, and we're really worried about that in relation to deep Medicaid cuts. So we have to do more to support family caregivers directly in terms of economic opportunity. And then second, family caregivers report that tax credits would be helpful to them. So one of the things that we see is the tax code does very little to recognize the work of caregiving. Family caregivers conservatively spend about $7,000 a year in out-of-pocket expenses related to caregiving, yet those aren't tax deductible. I think about my husband, he's a teacher. When he's buying school supplies for the classroom out of his own pocket, he's able to deduct that from his taxes. That's not the case when you're a family caregiver and you're buying necessary supplies in order to provide care. You're not able to write those off on your taxes. And so there's more that can be done from a tax code perspective to recognize family caregiving. And then third, folks want paid family and medical leave. What we see is over 60% of family caregivers are managing both care for a loved one while also trying to maintain a job, earn a paycheck, put food on the table. Yet we're one of the few industrial nations that doesn't have a national paid family and medical leave policy. So more and more family caregivers are forced to make hard choices between, do I stay in the workforce, earn that paycheck, or do I leave the workforce in order to provide the care that I need, because there aren't those policies in place? So really diverse set of policies that reflect the diverse realities and challenges that family caregivers face every day in this country.
I appreciate that. And I often reminded how I think you and I work in jobs where there is that flexibility for family caregiving, and really appreciate that. And I think that's so important that we all have to remember that. I last year was in a position with an aunt who was ill and was able to take the time I needed, as well as even just have flexible time in my role here to be able to work a little bit in the morning and then a little bit later at night. But not everybody has that. And I think it's important for us to all remember how that could go a long way for so many family caregivers. And I think about other friends and colleagues who have said to me, I could never do that. And in professional positions where they're like, I have to work a schedule that I have to work. And so I think learning that flexibility and what we can do to partner with our employers could be so important. Not to
Absolutely.
mention the other issues that you raised.
Yeah, absolutely. I think employers really have a big role to play. And you gave a great personal example, and we are privileged to have flexibility. And what we're seeing is more and more employed caregivers report having access to increased employer-based supports. And that was one of I talk about some of the glows that we see. We really focus on the lows and the challenges, but there are some glows that we see coming through in the data, and one of those is around employer-based recognition and support for family caregivers. So we saw some significant increase between 2015 and 2025 in support for employed family caregivers, and things like workplace flexibility and things like access to paid family and medical leave, in areas like access to caregiver assistance benefits like concierge services, like our member Clio and Carry Loop, sort of companies that work with employers and support employees as they navigate caregiving responsibility. So there are some positive trends in that direction. But like you said, and you recognize, some folks aren't able to take advantage of those flexibilities. If you work a shift in a bread factory, or if you're an hourly non-exempt employee, for example, you don't have access to a lot of those benefits. And we saw that in our data. We saw there were big disparities in salaried employees had access to compared to hourly based employees. So you think about it in terms of the corporate executive in the company, the kind of benefits they get are often a lot different than the frontline workers, folks working those shifts or an hourly basis or on a part-time basis. And usually those folks that are in those ranks are lower income, lower educated, folks who have increasing caregiving responsibilities, and oftentimes caregiving both for children and for adults in their lives. So it really underscores that while there's progress, there's tremendous need for continued policy focus in order to address the gaps that we see.
And I'm wondering if there have been any initiatives from federal policy that we've seen advance on some of these issues that we should probably make our listeners aware of here.
Yeah. So there's been tremendous progress while we're working and hoping and organizing and mobilizing around federal level progress, right? Particularly on issues like paid family and medical leave. Shouldn't matter what state you live in order to balance care for a loved one while staying in the workforce. But we've seen states say, hey, we can't wait on the federal government. So over 13 states have paid family and medical leave policies. That number goes up when you think about more limited policies like just parental leave. And so paid family and medical leave, paid parental leave, we're seeing more states put that infrastructure in place every year. So that's a positive movement in the right direction. We're seeing states like Nebraska introduce caregiver tax credits. So again, waiting at the federal level to pass the Credit for Caring Act, but at the state level, states are mobilizing and advocates are mobilizing, saying, hey, we need to recognize the caregivers in our state with the caregiver tax credit. What we're seeing in places like Washington State is voters in Washington State have established and protected long-term social insurance program called WACARES, LTS and insurance program to protect and for folks to buy into long-term care insurance. And it's now setting the trend in other states like California and Massachusetts are considering the same thing. At the federal level, there's increased conversation around something called the WISH Act, which would be a catastrophic long-term care insurance. But there is progress. And what we say is what we see from these wins is that when care is on the ballot, it wins. So there's hope at the federal level because the states are showing the way that this is something that voters want, and that cuts across political lines, right? We're talking about care winning in a red state like Nebraska. We're seeing it work in a state like Washington. So there's really opportunity, no matter where you are, to support and build infrastructure for family caregivers.
That's such a great point. You mentioned the Credit for Caregiving Act. And I was wondering if you could just talk about that briefly. I know GSA is supporting that act. I know National Alliance for Caregiving is supporting that. Can you just, for our listeners, just talk a little bit about that?
Yeah, so Credit for Caring, which is championed by our friends at AARP and a broad coalition, and GSA, a great example of that. We're supportive of it as well because it really hits on something that family caregivers want. Family caregivers, particularly family caregivers in middle and upper income household. That's something that we saw in our data. So our family caregivers in households making $50,000 or more were really supportive of a caregiver tax credit. And it's important because, like I said, caregivers are spending out of pocket thousands of dollars annually in order to make care work for their families. And yet they're not able to write any of those off in their taxes. And so what the Credit for Caring Act would do was establish a tax credit up to $5,000 of qualified expenses. So medical expenses, for example, you'd be able to incorporate those into your tax return and reduce your tax liability as part of the Credit for Caring Act. And so it's not a silver bullet. There are things about it that we would like to see change. For example, it's non-refundable, right? So it really impacts who's eligible, but it's a move in the right direction, right? It's something to build on. It's something to make the tax code fairer in a way that recognizes the tremendous value and economic contribution that family caregivers bring to the table every single day as they provide care.
And so it's been introduced. Did it get introduced? It got introduced again this year.
Yeah, there was some mumbles. It was one of those issues that got brought up on the campaign trail. So both our President Trump, when he was campaigning, talked about the importance of tax credits for family caregivers. There was some movement in related to the One Big Beautiful Bill Act, but it's still out there, still gaining momentum and really looking for a vehicle to see it across the finish line. It's one of those things that folks have been working on for a long time. But I like to think about these issues as being generational issues, right? This is something we're always going to be tending to caregiving as an issue and as a community. And so I see it's not about if this will happen, it's like when it'll happen as more family caregivers start to talk about and recognize the importance of these policies. I think we're going to start to see more incremental wins, including on the Credit for Caring Act.
Yeah. I want to follow along a little bit more about issues that caregivers may have related to. Sometimes we're expecting people to understand complex medical tasks. We're expecting people to understand all the nuances in caregiving or when you think about all the services and supports that are there. And I was just wondering if you could just talk about some of the ways that we can enhance caregiver competence, ways that we might be able to mitigate that burnout that people might experience as caregivers, because we know that there are health consequences for caregivers often that while working to take care of a family member or loved one, even a neighbor, this can really start to impact you.
Yeah, absolutely. I think it's a great question because it really does reflect the changing reality that we see among family caregivers is that one, I talked a little bit earlier, it's becoming more prevalent, right? More people are engaged in the work of family care. We saw a nearly 50% increase in the number of family caregivers in this country between 2015 and 2025. And what we also see is that caregiving work is becoming more complex and more stressful. So what we see, and it's also lasting longer. So what we see is that over 70% of family caregivers are providing care for an individual who has two or more health conditions. So managing chronic and serious illnesses alongside other chronic and serious illnesses. What we see is they're providing that care for longer. We see that over a third or around a third of family caregivers are providing care for someone for 5 years or more. And that's up from 2015. So it's becoming more complex. and it's lasting for longer. And there are consequences of that, as you alluded to. The impact on the family caregiver is one in terms of the health of the family caregiver, but then also the impact of needing to learn more associated with your care. And so we saw, like you mentioned, over 60% of family caregivers report that alongside managing your kind of typical activities of daily living, like feeding and bathing, and instrumental activities of daily living, like managing finances, we see family caregivers managing complex medical and nursing tasks, things that historically have been supported in acute care settings and more moving into home-based settings. Things like from one end of the intensity spectrum, managing medications, to the other end of the intensity spectrum, changing PICC lines and learning how to do that by YouTubing. We hear that all the time, right? There's very little support in place. In fact, according to our research, just 22% of family caregivers reported receiving any kind of training for the assistance that they provide for the people in their lives. And so really we're relying on family caregivers to be an extension of our healthcare system, to be part of really complex healthcare delivery in this country in a way that we're borderline on exploitation of family caregivers, right? There's this amazing stat from McKinsey, the consulting company, that said by the end of 2025, nearly $300 billion of healthcare value is moving from hospital-based settings into home-based settings. And I think about where's a lot of that value coming from? And it's coming from the contributions of unpaid family caregivers, right? From family caregivers shouldering more and more of the responsibility of the healthcare system in homes without training or support. Now, part of that is because of positive developments in healthcare, right? More people being able to live longer, more breakthrough therapies and interventions that can be delivered in home-based settings versus acute care settings, which theoretically could save everybody money over time. We know that people want to live and age and receive care in their homes. We just have to make sure that we do it in a way that's sustainable and doesn't lead to the kind of burnout that you talked about, in a way that we're not exploiting and benefiting from family caregivers when they're not also receiving the support that they need. So we really think about that in kind of two buckets right now. One is better integration and formal recognition of the caregiver in healthcare delivery. So recognizing that what they do has tremendous value and deserves formal training and support. And so we've been big champions alongside others, including GSA and others in the field, around championing caregiver training services and caregiver training. So this is one of the, again, a glow that we've seen policy-wise, is that Medicare has introduced reimbursement for healthcare providers to identify and train family caregivers as part of care recipients' care plan. So now there's an incentive for healthcare providers to train family caregivers, to increase that knowledge base that family caregivers have in order to provide care, particularly around complex care. Again, it's not a silver bullet. We want caregivers to receive support. We've heard from some family caregivers, I don't want training. I need someone alongside me who can do this work. And we have other family caregivers who are like, wow, I wish I knew how to do that better. I'd have more confidence, right? So it's not a silver bullet, but it's a step in the right direction. There's a huge need to think about what other kind of provider types can be reimbursed in community-based settings. Beyond the registered nurse and nurse practitioner, who else can be trained to support family caregivers? So I think that's an important move in the right direction, is that training for family caregivers. Two is that direct payment for family caregivers, right? Sort of getting them engaged in care and recognized in care, and that they're providing the services of a direct care worker. They should be eligible for payment to help increase that sustainability of care. That becomes really important. And these are really important aspects of how we make caregiving more sustainable in this country, and both recognized by our national strategy to support family caregivers. I know we wanted to talk about that, which is our nation's first ever national framework around how to better support family caregivers. And it was catalyzed by a piece of legislation that was passed in the 2017, 2018 signed into law by President Trump. It was bipartisan vision that was developed. And then as part of that legislation, the administration had to create a national strategy that was a public-private, folks from agencies like CMS and CFPB, really diverse set of agencies working alongside a council of family caregivers and grand families, alongside organizations like GSA and the National Alliance for Caregiving, alongside family caregivers, alongside researchers to develop a roadmap, our first ever national roadmap with distinct actions to support family caregivers. And goal 2 of that is stronger partnerships and recognition of family caregivers in healthcare and long-term service and support settings. So there's, I think, a tremendous opportunity to do better in recognizing family caregivers who are delivering complex care, but we're also seeing some incremental but important progress in doing just that.
And since you mentioned it, the national strategy to support family caregivers, I know that the National Alliance for Caregiving leads the Act on Raise campaign. And I was wondering if you could talk a little bit about that. And the one question that I have is, and often when we're representing our members in these meetings, when we're representing our constituencies, we talk about how this is a national strategy. So it's not a federal strategy, it's a national strategy. And that importance of partnership, that public-private partnership. So I was just wondering if you could tell us a little bit more about the Act on Raise campaign and tell us a little bit more about some of the other areas that you see we have opportunity to
Absolutely.
improve services and supports for caregivers.
Yeah, and I can break some news, and I think
Awesome.
where we started Act on Raise as part of a campaign really to drive action on the national strategy. So one of the things that we've believed from the very beginning, alongside our partners like the John A. Hartford Foundation, which is a cornerstone supporter of the Act on Raise campaign, is that a strategy is only as good as its implementation and support for implementation. And so really, we felt there was a need for an advocacy movement around the national strategy to ensure that it was advanced. And we've seen some really solid progress since we launched in 2021 in terms of implementing some of the actions and visions of the national strategy. And what we quickly realized is that the national strategy is so much bigger than just the RAISE Act, right? The RAISE Act was a legislative vehicle that made it happen, but really the national strategy is about supporting and recognizing our nation of caregivers. And so we're actually changing the name from the Act on Raise campaign to the Caregiver Nation Coalition, which is very exciting. And that announcement will be made publicly very soon. But we were excited to work with our steering committee, which really cuts across the aging, disability, and care and patient advocacy communities and our campaign partners like GSA to raise the visibility of the urgency of implementing these actions and sustaining this plan, right? This plan that needs to evolve over time. One of the things I continuously say is caregiving will always be with us. We're not trying to cure caregiving, right? I come from the Alzheimer's community. We were laser focused on we're going to cure Alzheimer's. And until there's a cure, there's care. We're always going to have care in this country. We're always going to need a framework that brings together the federal government with states, with philanthropy, with the private sector around how do we coordinate and have the same sense of direction that we're going in terms of supporting family caregivers. And the strategy does just that. And so the campaign really is focused on driving that action. So some of the things that we've done are advocate for investment in the strategy. When the strategy was first released, it had no new resources. It was like one of the big criticisms of the strategy was that, oh, great, it's another unfunded mandate. And that was something, there's a lot of things that go in the background and getting things done and sequencing. So we have been a really strong voice for investing in and appropriating funds to implement the strategy. And so now we're seeing over $20 million annually in appropriations from ACL to implement the strategy, both at the federal level and at the state level. So building the capacity of states to implement the strategy, which is really important.
That's huge.
Exactly. And it creates opportunities for others to drive community-based organizations. This is, again, like you said, not just a federal strategy, it is a national strategy, and everyone has a role to play. And these dollars really help to leverage and mobilize others. So that's been a key development to pushing for innovation, like the introduction and expansion of caregiver training services. So seeing from the first introduction of those reimbursement pathways to see a steady expansion of those in terms of the types of providers that are included, the types of training that is covered. We've been advocating strongly for expanding and optimizing with some really important success there. So it's been a really important platform for partners to come together across aging, disability, and patient advocacy to drive and build the vision of what that national strategy can be over time, with really a focus on recognizing that this is a nation of caregivers and those caregivers deserve support across all those ways that they're challenged by their care responsibilities.
That's awesome. And I'm so glad to hear the expansion and the renaming the Caregiver Nation Coalition. That's so exciting to hear, thinking about where we were at the start before even the Raise Family Caregiver Act was like the efforts to get the Raise Family Caregiver Act passed, and now to see this blossoming as it is, and recognizing that we really can impact care for people across the nation. I think that's
Absolutely.
fantastic. And thank you for sharing that on this podcast. I was wondering, maybe we could talk a little bit about the Caregiver Nation. I know that's been the summit that we've participated in, that the National Alliance for Caregiving has hosted for the last few years now. And the 2025 Caregiver Nation Summit is coming up November 5th and 6th. And I know you'll be sharing insights from the report that we just talked about, and you'll be bringing together experts from around the country. But do you want to tell us a little bit more about that?
Yeah, absolutely. So we envisioned this 3 years ago as an opportunity for caregivers, family caregivers, to have a spotlight on Capitol Hill, right? We go back. I used to be in Alzheimer's advocacy, so I've done a lot of patient advocacy work, and it was great to see family caregivers integrated into other advocacy days, whether that was in a serious illness work or around aging. But really, there was no platform for sort of the family caregiver issues alone, getting that spotlight. And so that was the vision behind Caregiver Nation Summit. We envisioned the Caregiver Nation Summit as a platform to put a spotlight on the issues that we need to change and move to support our nation's 63 million family caregivers, with the national strategy as that framework. So educating policymakers about opportunities to bring that strategy to life, whether through appropriations or through legislation like reauthorizing the Older Americans Act, which is really important to advancing so many of the goals of the national strategy. So that's what we do. We bring folks together from all over the country for a day of dialogue and networking around what could the future of care look like when family caregivers are better supported? What needs to be in place in order to create that future aligned with the national strategy? So we've had folks like Governor Michelle Lujan Grisham talk about the role of states in supporting family caregivers, about translating her lived experience into policymaking. This year, we'll have a great lineup of experts talking about the insights from caregiving in the US and the trends that we've seen, and how we can, one, build the momentum that we see in certain areas like employer supports, or work to address the challenges that we see around issues like navigating serious illness and complex care. So we'll be hearing from folks like Governor Spencer Cox of Utah, who's done a great job. Utah has done a great job to recognize and put in place state policy to support family caregivers. We'll have a fireside chat with Emma Willis, Bruce Willis's caregiver and wife, as she's been really open about caregiving for Bruce Willis, who has frontotemporal dementia, and sharing what that experience looks like and how she's learned from that experience about the challenges that family caregivers face. So we're really excited to have her in person for that chat. And then on the 6th, we'll head to Capitol Hill. We'll have over 100 advocates join us from over 12 states, including a 10-state network that we convene in partnership with grant makers in aging called the Caregiver Nation Network, where we have coalition leaders from family caregiver groups and aging groups from all over the country who will come together around appropriations, the importance of sustaining funding for family caregiver support programs, and for reauthorizing the Older Americans Act. We really see that as a key support for family caregivers, one of the few national programs that really cuts across all different types of eligibility so that folks can receive things like training and peer support and respite support through aging service providers across the country. So we're really excited about having I think, a really compelling agenda that centers the experiences of family caregivers and policy change in support of family caregivers, and then be able to channel that directly with policymakers on the 6th to show members of Congress and their staff that family caregivers are here, they're watching, and they're expecting policymakers to recognize and value their contributions.
So for our listeners, we will have information about the summit in our show notes. And if you are still interested in registering, that information will be there. We hope that we will see you here in Washington, D.C. for part of the Caregiver Nation Summit.
Or virtually, we'll have a virtual component, which so everyone can participate. We have a virtual option. And as you check your emails or drink your coffee or have your afternoon tea, you could plug into Caregiver Nation Summit and see what's happening online.
And then take the opportunity to tell your story with your member of Congress when they're back home. I know that it's really important to tell those stories and tell those stories to drive the policy change that we're seeking. So that's so important, and really excited about participating in that again this year. Jason, I can't believe it, but we're coming to the close of our conversation. And I was just wondering, is there anything that you thought, Trish, I thought you were going to ask me about that you'd want to just provide some key comments on?
No, I really appreciate the opportunity. It's been great to partner with GSA and with you to envision what this can look like. Because I think one of the most important things to remember is that when we look at our data, one of the biggest communities of family caregivers are folks supporting healthy aging and folks as they age in their homes and communities. So really critical to build those bridges between the family caregiver community, the aging community, and such a big part of that is our partnership. So really grateful for your support and your vision. And I am optimistic about the more caring future that we're building when we do build those bridges between organizations, between movements, and between people. And I appreciate you sharing your care experience because we all have one. And the more that we can share those with each other and with policymakers, then the closer we get to building that future, whether that's a future with healthy aging, with better supported caregivers. It's all part of, I think, an opportunity to do better for the people that we love.
I just want to thank you as well for partnership. Really enjoy working with you, with your team members. It's been such a valuable relationship. And I know that our members see that as well, particularly our colleagues who are members of our family caregiving interest group, who really are leading the way on the research and to support those evidence-based policies and those evidence-based practices. Thank you for this long-term and continued relationship with the National Alliance for Caregiving and GSA. I want to thank you for joining us and wish you lots of success with the summit and continued success with our policy initiatives. For our listeners, as we come to a close, if you do have any questions, please don't hesitate to reach out to us at profaff@geron.org. So profaff, a shortened way of saying professional affairs at geron.org. If you have questions for Jason specifically, not only reach out to us, but I'm sure you can reach out through the National Alliance for Caregiving's website at caregiving.org, caregiving.org. and you'll find great information there, and you'll be able to reach out to Jason and his team for other questions. I want to thank you for joining us today. It is important that we continue to raise all of these issues for our members and for all of our listeners. This has been a great addition for our Policy Profiles podcast. Please join us and continue to share this information with your colleagues, and keep up to date with GSA's latest advocacy activities at geron.org/advocacy or on GSA Enrich for more information. Thank you again, and everyone have a great day.